The main question that I wrestle with as the former lead on injection safety is that in peacetime, regular times before COVID, WHO, my team, said that 1 million people die every year from the infections they get at the end of a dirty syringe that's being reused with glass vials. So that's more than die from car accidents. And with the world's biggest vaccination campaign, in very complicated cases like PNG, like the refugee settings you just explained, we are in for massive syringe reuse if we don't pre-position and work harder on this.
So let's talk about overusing a syringe. Can steps be taken to sterilize a syringe that has been used?
Great question, and the bottom line is no. No syringe, plastic syringe that we use now, can be safely sterilized and reused. Back in the day when we had glass syringes, we used to reuse them for a lot of other reasons. Now, syringe reuse, we feel, because it happens in regular times and will now have added pressure from the 14 to 19 billion vaccinations we'll be doing, you could see as many as 2 to 3 million people dead, not from the vaccine, it's important to say that, but from the vaccination that will be carried out unsafely.
And some of the issues that can arise can be years down the track.
That's exactly right. I mean, you don't immediately sort of fall over injured or dead when you get a wrong vaccine. You get a disease, bloodborne. Just last week, it's timely we're talking about this, was World Hepatitis Day. It's hepatitis, it's HIV, it's many other bloodborne diseases that then crop up anywhere from 9 months, 2 years later. And it's a problem that's hidden. Therefore, we don't talk about it enough. It's little pockets that will happen. But now with the world's biggest vaccination program coming, we will for sure see 2 to 3 million dead, or perhaps even much more if there are not enough syringes in place.
So if vaccines are supplied, if syringes are supplied with vaccines, is that even a possibility, or would there be the supplies to do that?
Well, it's a great question. Actually, when I talk to people about this, most times people are surprised to know that people who make vaccines don't automatically provide syringes with them. And the COVAX program, as great as it is and as hard as it's working, is focused on vaccine doses. So now the problem has not been talked about because it doesn't exist yet. We have been so bad, unfortunately, at getting vaccine doses out there to the world. But later this year, the G7 has committed to at least 1 billion doses. Into 2022, WHO is preparing for 1.6 billion doses to be committed. We will have more vaccinations and injections happening around the world in challenging settings like you were just talking about than we've ever had. It's the potential to be the world's biggest patient safety event we've ever seen.
Yeah. It'd be interesting too, though, if the message gets out that syringes are needed and they are redirected from other programs. Could that also pose a big problem?
That's a second big problem. It's a great point. Just a week ago, WHO and UNICEF published a report looking at the state of vaccination, saying that 29 million children, the highest for a decade, were not vaccinated last year. Now, it wasn't because of lack of syringes, but 2022 will be the perfect storm where you will have a big push on vaccinations, injections in the developing world, syringes being reused, and the pressure, because COVID's on the headlines for every country, to borrow from Peter to pay Paul, to borrow regular childhood vaccination syringes to roll out COVID vaccination. And that'll be a challenge for every country going forward, and organizations like UNICEF, the Pan American Health Organization, are working hard to try and prevent that.
It's a kind of devil's choice, isn't it? Would it be safer to not administer COVID vaccines unless there was sufficient syringes?
Definitely. The threat from unsafe and syringe reuse is clear. But in many of these countries, we'll have to see how the shape of the epidemic rolls out, and being able to have safe syringes in place and the people trained to safely administer the vaccine. Those are the two things in a recent Washington Post opinion piece we did with Margaret Chan, former Director General of WHO. We said you need the devices, you need safe syringes, ideally pre-filled single-dose syringes, and you need the people to administer them.
Yeah. If I could ask you too a question about what's unfolding in the United States, how concerning is it, the vaccine hesitancy you're starting to see there, and how is that feeding into this Delta variant outbreak?
Yeah, it's a great point, and one that perhaps your viewers can start to take on board. Australia's done a great job on containment, and as it moves stronger on the vaccination program, the U.S. was a little bit the reverse, not great on containment, but very strong on vaccination. There is a big concern on 2 points. And again, it gets back to this point we're making earlier. First, hesitancy. It needs to be addressed locally. People need to be scared about COVID. When the interviews come, the people that say they are not getting vaccinated, they also say they are not worried about the consequences of COVID. So they need to be afraid, and they need to get those messages from a local provider, which is the second piece. The next phase of the rollout in the U.S. must go to the community. You have to have an efficient program that, again, argues for simple syringes, pre-filled syringes that are single dose like we do for influenza. We made workplaces a place where we can vaccinate people, pharmacies a place where we can vaccinate people by using these types of syringes and these approaches on immunization. So it's a lesson for all countries, I think.